it looks like we're live, ready to go. All right, buddy, go ahead. Hi, guys. Sorry, I'm running a little bit late today. I have my 11-year-old super genius helping me here. So we're trying for the first time to do this for both Facebook and, yeah, but don't think you're leaving anytime soon. My little guy keeps trying to bow out. That's not happening. This is for the first time we're going to try and do this on Facebook and YouTube because you guys know that I have a YouTube channel. Okay. I'm hoping that Mrs. Tasha Turner here is going to join up soon. Okay. I'm going to give everybody some time to filter in whoever else wants to, be a part of this. We're going to see if we can't do that. Zip it, please. Okay. All right, guys. So, hello. We're going to talk about KRATOM tonight, guys. I'm very excited about that. I realize that as I'm showing you this, it probably comes up in the picture backwards. I think we had this problem last time, and I had to try and, write things backwards. But that was a whole lot of fun. So, I am letting people filter in. Hey, Bree. I got the local girl support. What's up, girlfriend? Bree, our shops around here sell this stuff like crazy, by the way, and I can steer you where to go and where not to go. It's a good thing. So if you're local to Bree and I in New York, I can hook you up, tell you all the good stuff. And if you guys hear noise in the background, that would be my boys. Guys, when I do a lecture, I like to give, about 10, 15 minutes to let people kind of filter in. I know it's crazy because it's a Friday night. Everybody's kind of busy on Fridays. And trust me, I totally get it, Bring them on camera. It's a little tougher than that. But come here, Shawnee. Come stick your head in and say hi. Come here, just stick your head in and say hi. This is my super genius. This is my 11-year-old. So Sean has Asperger's, which means he's smarter than everybody else in the house. It's kind of amazing.
She gets bragging rights, ladies and gentlemen.
That's my guy. So I think next month I'm going to do a whole live lecture on autism, Asperger's, and the different portions of the autism spectrum disorder. So he's a pretty great guy, my little dude. Yeah, Bree, and you know what? So, guys, Bree and I live in Orange County, New York. I'm not going to say exactly where because I happen to do EMS there, too, and Fire Ladies Auxiliary on my fire department. But unfortunately, where we live, it's a very diverse area. There are, people from all walks of life, all ages, all nationalities, all races. It's a really, really neat mix of people. And unfortunately, we have a huge opioid addiction epidemic. So if I ever get House in here, if Tommy ever stops, Tommy's pouring soda at the moment. Tommy ever stops pouring drinks and comes and sits down and join the chat, he can tell you as well that last week during an ambulance shift, we pushed 12 milligrams of Narcan. Obviously not all to one patient, 12 milligrams. So, and that was just one night. It wasn't even the entire shift. I mean, it's insane. It's gotten so bad. And unfortunately, our opioid addiction epidemic is not, it doesn't affect just one type of people. It's the rich, the poor, the young, the old. One of our patients was a grandfather, an older gentleman. You would never in a million years think that this person had an opioid addiction, but this is what happens. And it's a shame. And, unfortunately, I do tend to blame the severity of this epidemic that we have in opioids on those that are writing the prescriptions or were. It got pretty bad for a while, but, it's gotten a little bit better, but that's not what we're going to talk about so much tonight, guys. We're going to talk about something called KRATOM. So it is currently 7:37. We are still going here. Nava. Hi, Nava. Hello, Nava. Just waiting a few minutes to get some more people to filter in.
How many people you got?
Okay, guys. Hi. Welcome. Nice to see everybody. Nava, thanks for coming. Nava, usually I'll put on the spot to answer questions about things, too. Nava's one of my best students ever. She's a graduate, and she's now kicking butt in the OBGYN community. So she is, she's doing really cool stuff, helping people have babies and And stay healthy. Women's health is, really, really important. Not just guys, the girls too. So she's doing some great work. So maybe one of these days she'll be willing to do a lecture on OB, which I know that some of you had asked about that. And I know that Tasha, Mrs. Turner, had asked about doing OB, but that's just, it's not what I do. It's not my thing. I do emergency, I do critical care, I do cardiology, and a little mix of things in between. But Nava does all sorts of OBGYN stuff, so she's your girl to ask questions to. It's really, really cool. So, so Nava will tell you that I firmly do not believe that most people, hey, Antoinette, nice to see you. Thanks for stopping by. Now I'll tell you that I firmly do not believe that everybody is cut out to be a nurse. They're just not. So every so often, I'll have a student or two that I pull aside and tell them flat out, if you don't go forward to nursing school, you're a fool because you're brilliant. Listen, I love working as a medical assistant. I have one of the best jobs in the entire world. I work cardiology. And not only do I work cardiology, but I get to take care of some of the 9/11 affected population for those like myself that worked Ground Zero at World Trade Center 17 years ago now. Wow, that was a long time ago. That's crazy. But, I get to take care of that population as well. But there's, medical assisting is so cool because it's a stepping stone where you can go so much further from there. It can lead to so many different avenues, and it's really kind of spectacular. So, all right, guys, I'm going to give it like another minute to people filter in. Guys, if you have friends that you think that would like to see this lecture, please invite them to the group. I can take a look and, approve member requests if you guys would like. If I see anything going on, just let me know. It's no big deal. There's my better half. Hi, Tom. Tom is the guy that drives the boo-boo bus for me when I'm in the back doing patient care. He's the best. Tom is awesome. Not only is he this great big guy, he's like 6'5" and almost 300 pounds. I mean, he's just a huge dude, but we call him our gentle giant. The patients see him and he has like this calming effect because he's just got, that calm attitude and, he's so nice all the time and he's soft-spoken and he's very gentle. So, the patients really love him. He makes them feel safe. He makes us all feel safe. It's really kind of nice. So, all right. So again, guys, if you want to invite people to see the lecture, Medical Divas, now's the time. If you have friends that are in Medical Divas with you, please invite them to the lecture. This is an interactive lecture. So please, 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 by all means, ask questions. When you guys ask questions in the comments, I'll try and answer them as I'm lecturing. Tom and Nava will often answer questions to me. When Mrs. Turner comes, she answers questions. It's kind of what we do here. But now it is 7:40. I've given 10 minutes, so we're going to get started, guys. All right, so tonight's lecture is the first part of what I've got so far is a three-part series on alternative medicine. So, I think in the healthcare community, in medical assisting, in nursing, in allied health altogether, we focus solely on Western medicine so much. But I think it's so important to be versed in natural medicine, alternative medicine, some Eastern medicine, because this stuff was here thousands of years before us. And you know what? It's going to be here thousands of years after us. And there is stuff that we are still using today that is wonderful. So tonight I'm going to do a short little lecture on this wonderful plant, this leaf called KRATOM, okay, which is very controversial right now. And you will see some heated debates happen on this stuff. I mean, heated debates. I am a firm supporter and advocate for KRATOM. I actually have on the back of my little notebook here my Save KRATOM sticker. I know that this comes up looking backwards. I'm sorry. Sean, you have to get on that, man. You got to fix it. I got to fire my my AC guy.
Hey, you haven't even paid me yet.
Except you're eating a big chocolate bar, so I think I did pay you.
Okay, yeah, you did pay me. All right.
All right, anyway, so KRATOM, guys. So this is an herbal supplement. It is a plant. It's a leaf, actually, that is indigenous to Southeast Asia. So this can be consumed in different ways. Some people will make a tea with it. People who live in the countries that it grows in will actually just chew on the leaves themselves. But when we get it here in the United States, typically it's in a powdered form, and you'll either get it as a powder. It does not dissolve in water. It's just like tea leaves. Tea leaves will make a tea in the bag, but they don't dissolve in water, right? Same idea here. So it's not like you just dump it in hot water and mix it up and you have this nice smooth drink. Actually, honestly, it tastes awful. I have a really hard time getting past the taste of it. My kids think that it smells and looks really icky, and they used to call it poop herbs because that's kind of what it looks like. But I tell you what, it makes it so that I can do my job every day, and I'm a, upright, happy, functioning individual, and I know many, many people that are as well. Mrs. Turner, if she stops in, her husband actually was in a terrible accident many, many years ago, and he takes Kratom on a daily basis just like I do, and functions pretty normally as well. So for me, you guys know that I've been a diabetic my entire life since I was a small child. So, I have issues with neuropathy, with, nerve damage, and some things that have kind of cropped up, after a lifetime of diabetes. I also have psoriatic arthritis, which is autoimmune. It's very simple to rheumatoid arthritis. And I've tried every NSAID known to man. And while, yes, ibuprofen is my friend, it doesn't quite do the job enough. So I add in Kratom. I also add in turmeric and curcumin, which is going to be discussed in the third lecture of the series that I do. Okay. Oh, and by the way, guys, number 2 of the series is going to be on CBD and medical marijuana. And I know that's also a really, really hot topic. So stay tuned, and I'll update you guys exactly on a date and a time that I do that lecture, but it will be coming up. So look forward to that one. Okay. So the scientific name for Kratom is Mitragyna speciosa. Like I said, it's a plant that grows in tropical Southeast Asia. So this has been used as a remedy for hundreds of years. So it can be used for all sorts of different things. It's often used for pain management, energy, as an anti-inflammatory, which is, what I really use it for. You guys will see late at night and early in the morning, my hands are just terribly swollen. You can see my ring is real tight around my fingers. They're like twice as swollen in the morning when I get up. But once I get up and I take my morning dose of Kratom and I get moving, the swelling just goes away. If I don't take that morning dose, then my fingers stay swollen. I'm achy and I can't get around as much. And I am busy, busy, busy. My alarm goes off at 5:45 and I'm typically in bed about midnight. So it can be used for anti-inflammatory. People will use it to combat depression and anxiety. And there's different veins of the leaves. There's a red vein, a green vein, a white vein, a Mang Da, a Bali. So there's different types of the leaf, types of the vein. So the one that I particularly like myself is Mang Da, is one type of Kratom, okay? So Mang Da is similar to white in that it'll give you a little bit of energy. It's not sedating. I don't want anything sedating. I work in healthcare. I'm taking care of sick cardiac patients all the time. So you know what? I really don't want to be altered in any way. So I tend to stick with those. The red vein people will sometimes use for sedation. Believe it or not, red vein tends to make me a little bit moody, and my family will tell you I'm cranky enough, so we don't need any more of that. And the green, some people will use that for pain control. That one happens to make my belly really upset, so I stay away from the green vein. My point in that is that, if you want to try this for whatever ailment you want to try and combat, you got to find what works for you. So what I found works best for, the pain from the arthritis, the inflammation, and just the fatigue that it causes is a mixture of Mang Da. I'll take a couple of the Mang Da, okay? And then Bali. I like the Bali as well. So guys, these are just 2 particular brands that we see around here. Yeah, Bree, we can absolutely have a conversation about where to go, but there are like 8 different places you can buy it just in our city alone. I'm not even kidding. So this one is OPMS. I happen to like this company very much. By the way, guys, I make no money off of this. I don't get anything. These people don't even know that I'm talking about them, okay? So I should just let them know. Yeah, Puff City Nava, that's one. She's out by me, though. Not so much out by you. But there's one of those in Sussex as well as Newton. So I happen to like this brand. They make all sorts of different ones. And I was saying earlier that this stuff is not soluble in water because it's a leaf. and it tastes really heinous. So I happen to like to buy it in capsules. So you can see here, it's a good size capsule. So, I mean, I would definitely only swallow one at a time. You know, that if you're not used to swallowing a lot of pills, they're kind of gross. You can see this one. This is the OPMS brand. These guys have like a little leaf on it. You can see that's their logo. This is another one here, and they come in all different strengths. They come in different counts, different weights. So this one is Bali. These are just plain. They don't have any markings on their capsules, but their capsules look almost just like this. There's another one called Gold Leaf that I like very much. A lot of people will buy this wholesale off the internet. They'll get it in powder form, and yeah, it does tend to be a lot less expensive if you buy it in the powder form, but I just can't stomach the powder. I can't, you know, so I would just rather pop my couple of capsules in the morning and be done with it. So I don't really mind paying the little bit of extra money. Okay, so the nitty gritty on Kratom. So this is where things get controversial. So Kratom behaves as a partial mu opioid receptor agonist, okay, which means it will combat pain with the help from the same receptors that opiates like, you know, morphine and fentanyl and heroin use. But Kratom is not a drug. It is not an opiate. And this is the most important thing. It is not a synthetic substance. This is a plant. Okay. I've heard people, you know, call this an opiate. It is not, okay? I've also heard people compare this to marijuana or to CBD. It's absolutely nothing like that whatsoever. This is completely different. As a matter of fact, this is in the same family as the coffee bean, okay? You'll hear people talk about it being, you know, addictive, and people will abuse it. First of all, people will abuse anything. I see people abuse some really dumb things. Unfortunately, our millennials nowadays are doing things like eating Tide Pods. So, yeah, my mother-in-law actually works in a local school system here, not where we live, but, you know, a couple of towns over. Oh, Mrs. Turner, here she is. Hey, welcome, welcome. Guys, our fearless leader has arrived. Yay. So anyway, so my mother-in-law has told us that actually the school district she worked at, they had middle schoolers that got in trouble for licking birth control patches to try and get high. So, I mean, unfortunately, people are going to get addicted to and abuse, you know, absolutely everything. And my kid had to leave the room because he's laughing so hard at that. Yeah, it's ridiculous. That's okay, Tasha. We know you're busy. Don't even worry, girl. It's a-okay. So guys, even some of the naysayers about this plant are admitting that it does some really, really great things, okay? So I was looking at an article recently. This article was on the website for the American Council on Science and Health. And the author of the article is a brilliant, beautifully educated author who I tend to have differing opinions on, but respect very much. And his name is Josh Bloom, okay? And you can find his lectures on ACSH.org. So this particular article that I was reading the other day, he wrote in March 2017, and he had originally written an article saying that kratom is a dangerous drug, okay? And of course, like World War K started, is everybody battling about kratom is addictive, kratom's not addictive. People do abuse it, people don't abuse it. But again, guys, people abuse things like Benadryl and cough syrup. So, you know, you can't keep everybody away from everything, you know, unfortunately. So, in that one article, he's comparing kratom to fentanyl and heroin, okay? But then in the newer article, the second one that he put out recently, which he calls kratom the lesser of two evils by far, and he said, I was wrong about kratom, and here's why. So he side by side compared the two. Okay, so he compared it to kratom and the evil opiates, your, you know, fentanyl and your heroin. Yeah, Mrs. Turner, you do here in New York and New Jersey as well. and you do also for Sudafed, what has pseudoephedrine in it. Yeah, people can and they do this, all the time. So, where was I in my notes here? So in 2015, okay, there were 275 calls to poison control that were all they suspected had something to do with kratom poisoning, okay? And guess what? There were 0 deaths. That's right, 0. There were no deaths. As a matter of fact, thus far, there has not been one suspected overdose, not one, for just kratom. Anybody that they said overdosed and died from kratom, they actually had other things found in their system that they found to be the culprit. If you talk to anybody who uses kratom on a daily basis, is very educated in it, they'll say for the most part that you kind of can't OD on this stuff. You'll just get sick and throw it back up. And that honest to God is the truth. Now, I say never say always. You guys know that. But for the most part, you really can't. You'll just puke it right back up again. And it'll upset your stomach. So, okay, guys. So there were 0 deaths then. There are 0 deaths now. So when we talk about fentanyl-related overdoses, okay? So go back to 2015 again. They have a lot of good data on the books from 2015. When it comes to data and stuff like this, it always tends to be a couple years behind for what we have. So for Ohio, just Ohio alone, for fentanyl, okay, just fentanyl, that's not counting all of the other opiates, all of the other substances that people overdose on. There were 1,155 overdoses on it that year, okay, just fentanyl. So the CDC estimates that overall there were 33,000 overdose deaths in 2015, okay? And they think that at least half of them were from an opiate, okay? And we're talking overdose deaths. So we know that there were thousands, tens of thousands of them that were from heroin, and that tends to be our biggest enemy, our biggest monster. I was talking a little bit earlier about how when Tom and I were in ambulance duty the other night, we ended up pushing a total of 12 milligrams of Narcan, and I mean, it's unbelievable. Anybody here that doesn't know what Narcan is? Okay, if you don't, you definitely need to get educated on this, and maybe I'll do a class on it tonight, coming up soon, I mean. So Narcan is a substance that we give to a patient who has had an opioid overdose. And what it does, it goes to the receptors where the opiates will lock onto and cause that severe CNS depression that we know is an overdose, right? Drops the respiratory rate. Heroin, fentanyl, any of these opiates that we overdose on, it drops the heart rate, drops the blood pressure, and eventually it's a nice way to just go to sleep and not ever wake up again, okay? So they'll just grab onto every receptor, those molecules of the opiates. So what Narcan does is it comes in and it knocks them all off, and it comes in and it acts like a bully, and it throws elbows and punches and kicks, and it knocks them off of all of the receptors, and it says, nope. And if you've been in EMS for a long time or long enough, there is a movie starring Nicolas Cage called Bringing Out the Dead. It's a fantastic movie. And honestly, I think it does a pretty good job of explaining how, haunting our profession really can be after a while. So there is one scene in the movie where they get called for an overdose in a nightclub, and Nick Cage and Ving Rhames is his partner. They go in and Nick Cage pushes Narcan. And I mean, it is fast. Now, typically when we give it nowadays, we actually give it nasal, okay? It's almost like a little single serving of like a Flonase, any kind of nasal spray, okay? And we stick it up there and you just shoot it on up in there. We can't always get a line right away. Some ambulances, we're allowed to start lines. Some of them you aren't. Depends on what your certification is. Depends on what state you live in. But it's not as simple as just getting a line. And honestly, putting an IV in a patient takes a little bit of time. I can run over there, cram this thing up their nose, get it in them, and then we're going to ventilate them, guys. We're going to bag them. We're going to use a bag valve mask and ventilate, 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 okay? You would be amazed. Within 60 seconds, their respiration and heart rate will come up a little bit. Their blood pressure starts to come up. They start to be a little bit arousable. And within probably 4 or 5 minutes, that's it. It has, kicked all the drug out and they have woken up. So we can give up to, honestly, you kind of can't give somebody too much Narcan. You're not gonna kill them from giving too much Narcan. Oh, Thomasina, that's okay. Welcome, welcome. Glad you made it, girl. So the problem with Narcan is, when they wake up, a lot of times they're not grateful to you that you woke them up. They're mad at you because they just spent a lot of money on whatever their drug was, and you just killed that high for them. So they're not necessarily appreciative, which can be frustrating. But it's great. Within 5 minutes, they're up and talking and going, oh my God, how did that happen? Or, oh, I didn't take anything, which seems to be, the more common response. So guys, Kratom, not that it needs Narcan, but Narcan won't work on Kratom because it's not an opiate, okay? But Kratom doesn't have the ability to have the patient overdose like they will. Yeah, that's exactly what they say, Tasha. You blew my high, We had this grandfather, and he was actually a really sweet guy, and he lives, nearby. He was our patient, recently, 62 years old, this sweet man. And, had gotten in a terrible accident several years ago. A doctor had started by writing him prescription for Percocet for the pain from his accident. Lo and behold, we're 10 years later, and he's got a horrible, horrible heroin addiction. And, Tom tells me that actually we get called out to Narcan this guy a lot. So, he wakes up, and we're trying to level with him, and say, hey, look, buddy, you woke up. You were not breathing. His pupils were pinpoint. They were extremely constricted. That is absolutely indicative of an opiate overdose. And we're saying to him, buddy, you weren't breathing. You really weren't doing a whole lot of anything. And within 4 minutes of us giving you this medicine, this Narcan, you woke right up and are fine. So what did you take, pal? I didn't take nothing. That's unfortunately what they do. But I would rather that than the one that's now swinging at me. He's mad because, like Tasha says, because you blew my high. It's a thankless job sometimes. So anyway, guys, so we have all these overdoses from these opiates, whether they're prescription or street. There's really not much difference between your morphine and fentanyl and your heroin. It's kind of the same stuff. But there is none of this that happens with Kratom, and that's really what's kind of awesome about this. So, yeah, Tom is talking about. There was a doctor arrested recently for overprescribing opiates to known abusers. Tom, do you have the statistics on that doctor, the amount of pills and to the amount of patients that this doctor was writing for? I just blew my mind. And listen, I've been in healthcare well over 20 years, and to make me go, it's got to be pretty bad. That's usually what I'll tell my students. So guys, Kratom really is that simple, okay? There are places that you can get it online. If you have smoke shops in your area, you can get them at the little smoke shops, the head shops. Tom, if you look, that would be great. Thank you. So Bree, like Smoker's Choice sells it. There's that little corner store, it's Pike Street in West Main that sells it. They're really great people. I'm always a little leery because the problem with Kratom is it is not FDA approved, okay? So there's no recommendations on dose. You're never going to be able to look at the internet and say, hey, how much should I take? Because there really is no answer to that. There's also no really good answer as to, well, what kind of Kratom should I try? You start with a little bit of something and you kind of work from there. So guys, with these capsules that I have, okay, it depends on, stop moving the table. It depends on, how much is in each capsule. So if I've got, 500 milligrams in a capsule, well, maybe I'll want to start with 2 capsules and kind of go from there. But everybody's a little bit different. Everybody's tolerance is going to be different. Also, something to keep in mind, potentiators. So vitamin C. potentiates kratom. So there's a neat little shop there in Matamoros, PA. I live right in the where New York, New Jersey, and Pennsylvania all meet. It's the tri-states there. There's actually a rock by where the Neversink and Delaware rivers meet. You can actually stand on the rock and be 3 states at once. And I'm a geek, so I think that's really cool. Tom will tell you. There was a guy that used to come into the One Smoke Shop all the time that I would chat with all the time because I'm very pro-kratom and very like anti-opiate, who said, you know what, I find that when I take my kratom, if I drink some orange juice, it works so much better. So you'll hear people say, yeah, have grapefruit juice or have, a piece of grapefruit when you have your kratom. Has nothing to do with the fruit. It's vitamin C. So some people get a better effect of their kratom. It gets to be work more efficiently if they mix it with some vitamin C. So I do that. I'm a vitamin C girl anyway because I work in healthcare. Tom and I have lots of kids, so there's like germs everywhere all the time, and I need to never get sick. Yeah. So thank you, Tom. So that doctor wrote 27,000 prescriptions for painkillers over a 4-year period. As a matter of fact, he even had a couple of patients that were coming in on a monthly basis and would have sexual intercourse with him in exchange for their opiate prescription. That's pretty bad, What's terrible about this is that I do believe there is a place in the medical community for prescription opiates, okay? If you've had a big surgery and you need them very, very short term, if you're, have a terminal illness, you're stage 4 cancer, you're on hospice or palliative care, yeah, absolutely, okay? Yeah, 27,000, it's unbelievable. It's not good at all. Right. So if you have a condition where there is no other way to treat it, then yeah, you know what? Opiates might be appropriate at that point, okay, as far as pain controls go. But as far as managing chronic pain, opiates are not the answer to managing chronic pain. They absolutely are not. There are other ways out there. We have, wonderful pain management doctors. If you have a patient that you're really concerned is becoming addicted to an opiate and has legitimate chronic pain, refer them. Referrals, guys. Referrals to specialists are a good thing, okay? Refer them to an interventional pain management physician, okay? Those guys are great because they don't just go, hey, here's your meds. They're going to go in there and say, okay, let's get to the root of the problem and let's solve it. I'll give you a great example. Those of you that know me well know that I got attacked by a dog a little over 5 years ago. It destroyed the lower part of my face. If you look close, you see I have a scar there, okay? That's okay. So this dog, it was like a 125-pound Dalmatian, big scary dog. Dog came up, grabbed, and just wouldn't let go. They had to pry the dog off my face, rip the dog. So guys, if you are walking and you smack your elbow into something, what's the first thing you do? Ow! You put your hand to it, right? Ow! So they pried the dog off me, and the first thing I did was this, and felt a gaping hole where my lip was. So it was that bad. So, luckily I had a great plastic surgeon down in Morristown Memorial in New Jersey, which is now Morristown Medical Center. His name is David Abdakamo. Thank you, Dr. Abdakamo. You did an awesome job. But unfortunately, though he put me back together to look almost normal again, I had some pain issues for a while. I am pain-free now, or maybe that's because of my friend, the miracle leaf, kratom, okay? He referred me to Doug Spiel, who is a wonderful interventional pain management physician. Doug has several offices in New Jersey. He's got them in Basking Ridge and Cranford, I know. So I used to go to his Basking Ridge office. So Doug actually brought me into a same-day surgery, centers. They have these little same-day centers. Tasha, I know, is doing a course on cosmetic surgery recovery, and I'm sure she's going to touch on these same-day surgery centers, which are really great, guys. They're great for all sorts of things. So what he actually did was he went in and he knocked me out. And I was having migraines related to nerve damage here that had to do with the cranial nerves that were affected. And what he did was he actually brought me in, he knocked me out, and went up my nose into my sphenoid process, part of my sinuses up here, and injected lidocaine. And he says, I may have to do this a few times over the course of a few months, but eventually it should nip them in the bud. Well, That was August 3rd, 2013, and I am still migraine free. So, and before that, they had me on pretty high doses of opiates, and I really was not a happy camper about that. You know, you can't function on that stuff. So, it's really awesome, guys, and I'm so grateful. Dr. Spill, if you see this, thank you so much for what you did. I can, you know, I refer you patients all the time. I can't thank you enough. So yeah, guys, you know, it's nice. As far as side effects go, when it comes to kratom, constipation is one thing that you'll find. So if you have a patient that does take kratom every day, lots and lots and lots and lots and lots of water, okay? Also, stool softeners are good too, okay? Lots of fiber in the diet, you know, a diet that is conducive with a healthy GI tract. So Nava's asking a question. She says, I know we've talked privately about this for a bit. For discussion purposes, how many times do you think it's okay to Narcan the same person? So, Nava, are you talking in the same overdose or that same patient on different occasions? Because they're different. There are different answers to that, and you're talking about different ethics with the two different topics there. Narcan itself is relatively safe when it comes to drugs that I'm concerned about giving too much of, okay? If you suspect that somebody has overdosed, that is a great question. If you suspect that somebody has overdosed on an opiate, okay, on heroin, fentanyl, whatever, go ahead and give them as much Narcan as you want, really, because if their CNS, you know, their central nervous system has been oppressed enough that they have overdosed on this, you're not going to make them any worse by giving them lots of Narcan. So, but usually with 2 or 3 doses, they're waking up if it truly is opiates. If you are giving Narcan 1, 2 doses and you get no effect, then either it's not an opiate that they overdosed on. Guys, Narcan only works on opiates. It's either not an opiate that they overdosed on, or it was an opiate and something else along with that. Unfortunately, one of our overdoses recently was in a bar. We got a tiny little response from Narcan, but we think there was a whole lot more on board than just opiates. That gentleman ended up having to be intubated and a whole lot worse. So Nava's asking about Narcanning the same patient on separate occasions, and this is a fabulous question. If you are in any discussion groups or groups or forums where EMTs and paramedics are having discussions about, you know, overdose patients, you'll see 2 very specific sides of the fence here that will just blast each other. So on the one hand, I see it personally, this is an ethical issue, guys. This is a big ethical issue because I see it as, you know what? I'm here to resuscitate you. I'm here to save your life. I'm not here to judge you. That's it, okay? I'm not God. I don't get to judge. I don't get to judge anybody, okay? It's my job to shut up, give the medication, and bring you back. And if that means that I'm doing that every night or twice a night, whatever it is, well, that's what I signed up to do. So I don't really get to complain. On the other hand, these patients are getting Narcan for free for the most part, if you kind of think about it. Most of them are on Medicaid or get charity care and are getting this medication constantly. I actually carry Narcan with me in my car. I have a little Narcan kit. A lot of my EMS friends do as well. I know Tom has one. House has one. He's in the hospital, like dying, by the way, guys. Well, I'm going to drag him into the group tomorrow and probably do a little case study on his asthma. I hope you're feeling better, House. But they're getting this medication essentially for free. It's not necessarily a cheap medication either. And people will say things like, well, you know, if Narcan is free for addicts, well, then why isn't chemotherapy free for cancer patients? Well, that's very simple. We use Narcan to resuscitate somebody, okay? Chemo, while it can be life-saving, is not a drug used for resuscitation. It's very different, okay? It's very frustrating at times that you'll race to this person's house and you're sometimes not just pushing Narcan. You're doing CPR. You're ventilating the patient. You're bagging them. You're intubating. You're doing everything you can. You're carrying them down a flight of stairs or 5 flights of stairs. You're pulling your back out. You're sweating your butt off. Your dinner got cold while you're on your 3rd Narcan call of the night. This is what happened, guys. But you know what? And it's frustrating. And like Tasha said, sometimes they'll wake up and be like, man, you killed my high. I didn't want this. I didn't ask for this. The other problem that people are seeing is I've talked to several EMTs and paramedics who feel that, you know what, Narcan is just giving addicts, all the more reason to go and use. It's not really that simple, you guys. It's not really that simple. I don't necessarily know what the answer is to cure the opioid epidemic, that addiction epidemic that we have. And if you don't believe that it really is an epidemic, you're not looking close enough. I actually really love the A&E show Intervention. If you've never watched an episode of Intervention, you need to watch an episode of Intervention too. Really, it'll give you such a different look at how not only these patients, the hell that they go through as an addict, but also the hell that their family members and their loved ones go through with them. It's frustrating. And it's scary now because these heroin dealers have gotten very intelligent. They're very smart now. So addicts tend to go to the same dealer all the time. They know they're going to get their stuff. And addicts everybody knows one another and they all kind of talk. And so dealers that are, chronic dealers, they're dealing all the time. They'll mark their products with little stickers or little markings or a stamp or something that tells that person that's using that drug, oh, that came from this guy. So what they do is they'll have a deck of heroin is 10 little mini bags. Okay. Yeah, Tom just said, unfortunately, when you Narcan someone, it probably won't be the only time. That is absolutely correct. I don't think I've ever Narcan somebody only once or ever Narcan somebody that hasn't been Narcan before. Tom is dead on, dead on. I wish that wasn't the truth, but it absolutely is. So what these guys will do is, let's say they've got a deck, which is 10 little bags of heroin with their stamp on it. They'll take one of those bags and lace it with some fentanyl. Fentanyl, guys, is like the mother of all opiates. It makes morphine look like children's chewable Tylenol, okay? I mean, it's absolutely, it's the mother. That one and Dilaudid, the Magic D. Everybody wants vitamin D. Good Lord. So they'll put fentanyl in one of those bags. And what do you think happens when that addict does that bag of heroin laced with fentanyl? They overdose. They overdose bad. We end up having to Narcan them. The ambulance gets called. It's a big old mess. And everybody's talking in that community there. So what do you think happens? These guys are going, oh man, you heard about that overdose? Joe must have got some really good stuff. We need to find out who Joe's dealer is. And now all of a sudden these 10 people that heard about this great stuff that Joe overdosed on is now going to go to Joe's dealer. These guys are much smarter than they were years ago. These guys are making a mint. And what's interesting about, opiate dealers, heroin dealers, most of them don't use drugs themselves. They're smart. They're not going to do their own drug, So yeah, I do feel that in some respects it does give our addicts a little more ammo, I guess is the best way I can put it. A little more ammo to be able to say, hey, you know what? I'm just going to use anyway because they're going to come and Narcan me. Well, unfortunately, there may be a time when I run out of Narcan, okay? There may be a time that I'm on another call with somebody else and I can't get, to that patient fast enough to Narcan them when they overdose. So unfortunately, there are a lot of negative ramifications of it, but I tell you what, it's not up to us, guys. Mrs. Turner touched on that a minute ago. We don't get to judge you guys. If you feel that you have the right as a healthcare professional to judge your patient, then you need to you need to exit stage left now, okay? It's not the field for you if you feel that you have the right to judge somebody. You don't know what it's like to walk in somebody else's shoes. Most of the time, people that are addicted to a substance, addicted to anything, guys, it doesn't have to be drugs or alcohol. It can be sex. It can be gambling. It can be food. You have people that are on, watch My 600-Pound Life. I am a TV addict, but these people's stories are heart-wrenching, and people will become addicted to food and gambling for the same reasons that they do drugs and alcohol. They are trying to numb some kind of pain, and you have no idea what these people have been through. So you don't get to judge, guys. Anyway, I got a little off track here on Kratom. I do want you guys to know that Kratom, again, I said is not FDA or DEA regulated, so there really is no, hey, this is our recommended daily dose, and what we recommend, this and that, okay? But it is illegal in a handful of states, and there are many other states that they are trying to work on getting it outlawed. Those of us that are Kratom supporters who really truly see this making a huge difference are fighting very hard to not let other states outlaw. So currently, guys, the states where Kratom is illegal, because, hey, we've got to have all the information, right? Indiana, Tennessee, Wisconsin, Arkansas, Alabama, and Rhode Island. Guys, write to your lawmakers, write to your congressmen, write to your senators, write to your assemblymen. This is a plant, a leaf. It's an herb that is saving lives. Here's one of the other things, and the reason I've talked so much tonight about opiates, Narcan, and addiction is that in addition to just improving quality of life when it comes to, say, anxiety and depression, when it comes to, pain and inflammation, it is also helping people get off of and stay off of other opiates. This is a wonderful thing, okay? So, guys, when you have a patient that's severely addicted to an opiate, okay, say it's, heroin, fentanyl, morphine, oxy, any of these things that they get addicted to, and it's all the same stuff, guys, it really is. What happens is if they don't have their drug in, a certain length of time, they start to get sick. We call that dope sick, okay? So they'll begin to sweat, they get chills, they will have severe vomiting and diarrhea, itching, restlessness, paranoia, anxiety attacks. They'll have pain from head to toe. Watching someone go through opiate withdrawal is heart-wrenching, heart-wrenching. So, so many people will try and go clean on their own, or even go to detox and try and get clean, but they just cannot take it anymore. And those, withdrawal symptoms, that dope sickness is so, it's so unbelievably excruciatingly painful and terrible that they give up. They get desperate. I can't go through this sickness anymore. I just can't do it. So you know what? I'm just going to take a little of my drug, and whammo, they're right back on it again. Okay, it's terrible to watch them through. So switching over to Kratom, so weaning off their opiate and weaning on to Kratom will help them get off the drug without having to go through very much of the withdrawal symptoms. Now, when you have patients that are severely addicted for a giant amount of opiates for a very long time, they're going to experience a little bit of withdrawal symptoms when they're switching over to Kratom, but nowhere near as if they were going cold turkey or even, trying to go with something like methadone or Suboxone. So that right there is helping people. They're weaning from one side of the fence to the other. That reason alone, this is a life-saving plant. This really, truly is a miracle leaf. And I'm lucky enough that, my need for Kratom has to do with, my awesome arthritis at 40 years old. and making it so I'm able to function normally on a daily basis. But this is not the only wonderful thing about it, Again, guys, people that are addicted, especially people that are addicted to an opiate, nobody wakes up one morning and says, you know what? I'm going to go out and try heroin and become an addict. Right? That's not the way it works, you guys. It's really not. Most of the time, these people start out with something like star of the football team, falls, has a partial tear in his meniscus, which you guys should know is in the knee, right? Now I can tell you all about torn meniscus. So they fall, they tear their meniscus. Coach says, listen, we got 4 more games and we're going to win the championship, and I know you're going to win it for us. So what do? They go and they give these kids, Percocet. They put them on Vicodin. Just get through the game. Just get through those last couple. And guess what? 2 months later, you've now got a kid who's addicted to opiates. So eventually, whatever thing they give them for, these docs are great about handing out things like Percocets and Vicodin, stuff like that, even Tylenol, codeine, with dental surgery, with things like wisdom teeth removals to 15, 16, 17-year-old kids. It's so easy to get hooked on this stuff so fast. And then eventually the doc stops writing the prescription because the docs see, yeah, Tasha, athletes, big money. Exactly. Exactly. And so the docs will, eventually cut off the prescriptions because, listen, you don't need this stuff forever. You don't. So they stop being able to get it from their doctor. Maybe they'll try and go to the ER. Maybe they'll try and go to other doctors, Um, uh, um, and then they can't get it legal anymore. So then they try and get it illegally. But unfortunately, those same pills that their copay on their insurance was $10 is now astronomically expensive on the street. Okay, so we're talking a pill that should have cost, if you compare it with your copay, with your prescription, probably, $2 a pill is now 30 on the street. Okay, and one pill is not going to last anybody very long. So this is a big, big, big amount of money. Okay, unfortunately, they build up a tolerance to it pretty quickly. They need more and more and more. They can't afford this stuff anymore. But you know what's super cheap? Heroin. And that's how they end up switching over to heroin. They try and kick the pills. They try and get off it. They try finding a better way. But by the time that happens, they're so addicted and taking so much so often that whammo, once again, there goes those horrendous withdrawals, okay? So, no, screw that. So one of their friends says, hey, man, just try a little of the heroin. It'll take the edge off. That's how they get addicted to heroin, okay? It irks me when people say that, and listen, I've been in healthcare 23 years now. It's a long time, okay? People say that prescription narcotics, prescription opiates are not the reason for the epidemic. Bullcrap. Back in 2016, when I lived at the Jersey Shore, and I worked at Deborah Heart and Lung Hospital in Browns Mills, New Jersey, which was an amazing organization. I worked in the cardiac surgical ICU. Wonderful, wonderful hospital. When I worked down there, we would get heart patients a lot that we had in for valve replacements. I had a 20-year-old girl, okay? She was 19. She turned 20 in the 3 months that she was in my cardiac surgical ICU as my patient. So this kid, amongst other, and now I'm going to answer your question in one moment. That's a really great question. These kids, these people of all ages will get so addicted and end up using dirty needles, giving themselves staph infections, MRSA in the blood. If you've ever been my student, you know that there are only a couple of bugs that scare me. HIV is not one of the bugs that scares me. What scares me? MRSA, respiratory MRSA. These kids will have MRSA in their blood. I had this girl that had vegetation on her aortic valve, vegetation on a heart valve because of dirty needles from her heroin addiction. How did she get addicted to heroin? She was a field hockey player, a very good one at 16 years old. Got injured, coach made her play through. Now, there's other ways too. There's surgeries, there's other things. There's also, oh, I'm so sorry that your menstrual cramps are so hard, dear. Here, have one of my Percocet from when I had my, my cosmetic surgery, which Tasha's going to talk about in another week or two. Okay. Yes, Tammy, abso-freaking-lutely. These doctors should be accountable, okay? They need to send these patients to pain specialists. If you want to give them a short script and then refer them to pain management, fine. But she is 100% correct. They should not be taking care of chronic pain patients. Yes, thank you. Absolutely. So one of the things about Deborah that I really liked is that it's a teaching hospital. So we would have residents in, and they would have something called grand rounds, which is basically a lecture from someone given way more important than me. That comes and speaks to, at Deborah, it's any hospital employee. So they would invite in the doctors, the nurses, the techs, anybody who wanted to learn. It's a wonderful learning environment. So the last one that I was able to go to was in December of 2016 when the Assistant Attorney General of New Jersey came in, and he was giving a lecture on the opioid epidemic in New Jersey. And everybody was excited about this. And I remember sitting in this lecture. On one side of me was my nurse manager, who's got like 100 million letters after her name. And the other one was Dr. Burns, the head of cardiothoracic surgery, who's a wonderful surgeon, by the way. And he basically got up there, thanked everybody for having him, and said, we have a really bad opioid epidemic. We have lots and lots of people that are addicted to opiates. And you know whose fault it is? All of you. And everybody, you could hear a pin drop. Nobody moved, nobody breathed, nobody made a sound. And he spent about 90 minutes standing up there and basically told us all, you're writing too many prescriptions, you're giving too many drugs. Nurses, you're just doling out these narcotics without checking with the doctor and saying, hey, does this patient really need this medication? And he's right. He is right. We, the healthcare providers, are at fault. So, medical assistants, if you see a doctor that's doling out way too many pills, way too many prescriptions, it's okay for you to say, hey, you know what? Let's talk about this. Maybe you're not comfortable enough going to the doc. Talk to your nurse manager. Talk about, talk to somebody else that deals with corporate compliance. Talk to a supervisor and say, hey, listen, ethically, I have a problem and I'm worried about my patient. I promise it's the okay thing to do. And if you work for a physician that won't let you speak to him, that won't have a conversation when it's regarding your patient's care and anything, especially opiates, that's not the person that you want to be working for. It's really not. It's really, really scared. So Tammy is saying, what do you think about pharmacies stopping anything opioid related to be filled for only 7 days? Walgreens in Hollywood is now following this rule. I don't think that's a bad thing. I really don't, because Mrs. Law, earlier before you came in, we had talked about how I think there is a place in medicine for opiates. If we have patients that are, end stage chronic disease, that have terminal cancer, that are on palliative care, hospice, end of life care, something like that, there absolutely is a place for opiates, with those patients. So a lot of times when we have a patient that's on hospice and they're either in a hospice facility or they're at home on hospice, they've also got a hospice nurse. So a lot of times you'll have a nurse that'll come in and bring the medications filled for the patients in, or she'll be administering those medications. If you can't get to the pharmacy, or there's no one to get to the pharmacy to fill 7 days at a time, maybe you shouldn't be on the medication. You need to be more closely monitored. I don't think it's a bad thing. I really don't, And yeah, Tasha's got a great point there. We want to medicate everything. So I partially blame our opioid epidemic on JACO as well. Okay, the Joint Commission. If you ever work in a hospital, when you hear JACO, you go automatically. I'll do another lecture on JACO soon, guys, because you'll learn about that if you can do hospital work. So JACO created this pain is the fifth vital sign thing. They created these patient satisfaction scores, and one of the big ones that they wanted improved was pain control. Listen, I've heard a lot of people say it's their right to be pain-free. I'm sorry, that's not how life really works. And even if you're on good opiates, you're never pain-free. I'm not pain-free. You know what? That's life. Life's not meant to be pain-free. It's meant to be a good quality. It's meant to be, at a stage where you can function and enjoy your life. And I obviously do, but life's not necessarily about being pain-free, and people are popping pills for every little ailment ever. We do need to try and let our bodies heal. We do need to be paying closer attention to things like, alternative medicine, a good sleep schedule. There are alternatives to pain medication, like our KRATOM, like CBD and medical marijuana, which we're going to talk about. I'm going to do a lecture on that, guys, in just a couple of weeks. Like I said, keep an eye out for when I give the date to do that lecture. There are other ways. For example, I also take every day turmeric. I can never say that. Turmeric with curcumin. I take those little capsules. They turn everything like bright yellow. I use a lot of Goya Sazon seasoning. It's in that too. I love that stuff. So that stuff is really terrific too. And turmeric with curcumin is nice too. It's a spice that is very mild, and it's so good for the body. It's good for inflammation. It's good for the joints. I also take chondroitin. That's a really good one too. Yes, turmeric. Thank you, Tasha. I'll show you my bottle of turmeric when I do that lecture. In a few more weeks, I'm going to do one on other alternative medicine. We'll talk a little bit about things like essential oils and massage, chiropractic, things like that. But yeah, I'll take my little turmeric capsules. And I mean, you can get it in capsules just like this. And it's the same stuff as, the shaker you can add to your food. Nava, yeah, that's right. Nava takes it as well. It's great for the joints, and she's got all sorts of joint problems too. So I'll add it to my family's food. If I make a big pot of soup, I'll put some of it in. It's great for the body. So there's a lot of really, really great alternatives out there. Not everything has to be prescription medicine. Can we treat everything with alternative medicine without prescription medicine? No, okay? But I do think that there can be a happy medium between the two. I'm a type 1 diabetic. There is nothing in the world that's going to make my pancreas produce insulin. It's not. I love my mother, but she loves to post stuff on my Facebook wall about like okra water curing diabetes. Mom, I love you, but okra water is not going to cure my diabetes, okay? And I know Nava's laughing because we've had this conversation a few times too. She's cracking up right now. She's diabetic like me. So yeah, I gotta have my insulin. It is, a necessary evil, and it's synthetic. It's a drug, but there's nothing I can do about that. So yeah, I mean, there absolutely, needs to be Western medicine. But I also think that we don't have to Western medicine the heck out of everything. I think that we can also, do some alternative, do some Eastern medicine. All right, guys, I think that's pretty much it for tonight. If anybody has, shots. Now, Tosh, that sounds like a whole lot of fun. Shots, yeah. I was laughing about okra water and, I hate those stupid Facebook ads and those little, like, memes, the pictures with the words on them that'll talk about this food is going to cure your arthritis and that food's going to cure your Alzheimer's, and stop it. They drive me insane. So, all right, guys, so it's 8:35. I have yapped for long enough. I thank those of you who have come to, check out the lecture and add some questions. Tom, Tasha, Nava, thank you for fielding some of my questions. Mrs. Law, thank you so much for coming as well. I encourage you to, bring your students along. I try and do lectures like this, as much as possible, but I have this incredibly insane life between, cardiology and, EMS and my hubby. And I don't know when you guys saw last lecture for me, but those of you who don't know, Tom asked me to marry him and on Valentine's Day this past February, and I said yes. So we're busy planning a wedding and everything else. So life is really good. Now I'm actually going to help the kids herd the chickens and ducks in for the night. Yes, I'm serious about that. Any other questions you guys have? I like to leave my videos up in Medical Divas for about 24 hours after the lecture ends. I'm going to try and post this one on my YouTube channel as well. Guys, those of you that know the address to my YouTube channel, if you can, please type it in the comments. But I am that clinical instructor. That's my little thing. I have videos all about nursing and allied health skills, EKG, phlebotomy, anatomy and physiology, pharmacology, injections, you name it, I teach a little bit of all of it. So it's www.youtube.com/C/that clinical instructor. All right, guys, so please check it out, subscribe. I'm going to keep more videos coming. Again, guys, thank you so much for coming tonight. Invite your friends, invite other medical professionals. And we used to be just all about women, but we don't just empower women. We think it's important to empower the guys too, which is why we do have a handful of medical divos, and you guys will see Tom helping out, and you guys will see House come on once in a while. That's John Lucas. So again, guys, thank you so very much. I will see you again soon. Dream big.